Hey everyone, Professor Davis here, and we are going to talk about the musculoskeletal system and the diseases and disorders that go along with this. So before we actually get into the diseases and disorders, let's kind of do a brief anatomy overview of these two systems. So when we talk about anatomy and physiology, remember that the musculoskeletal system is composed of the skeletal system, which is the bones and joints, and the muscular system, which is the muscles. So let's talk about the bones and joints first. So the big thing here is that bones do provide a framework for your body. They offer you support, so you're not just this blob of tissue. And they're classified based on their shape and composition. And so we have long bones, and those are going to be longer than they are wide. We have short bones. Those are going to be like little cubes, like in your wrist, your carpals. We have irregular bones who have a real irregular shape, like vertebrae or things like that. We also have flat bones, like your sternum or the bones of your cranium that are more flat. Okay, and then we have the sesamoid bones, which are like your kneecap. So we have them classified based on those shapes and also based on the composition, the amount of kind of spongy bone and compact bone that they contain. Now, these bones do come together and they form articulations, which we call joints. This is where two bones meet, and they are going to be held together by ligaments. Ligaments hold bone to bone. Tendons are going to hold muscles to bone. Now, these joints are going to be classified by either structure or by their function. And so when we look at this, they do go hand in hand. That's what anatomy and physiology is. But some of these are going to have more movable joints, whereas others are not going to be movable. And so when we look at the joints, when we talk about more of the structural side, we see fibrous joints, cartilaginous joints, and synovial joints. Okay, and so they're going to have different types of movement. So you have the synarthrosis, which is no movement. That's like your fibrous joints, like in your skull, the sutures that you have in your skull. The ampiarthrosis is going to be slight movements, and so you see these sometimes in your cartilaginous joints, like in the pubic symphysis or between your vertebrae, because there's cartilage in between them. And then the diarthrosis are the freely movable joints, and those would be your synovial joints, like your shoulder, your hip, your elbows, your knee, that kind of thing. When we talk about bones, remember there are 206 bones in an adult skeleton, and in anatomy, you normally have to learn all 206 of those. Now, when we talk about muscles, there are over 700 muscles, and a lot of times in your anatomy and physiology class, you may not have to learn all of them. It may just be kind of the bigger ones that are going to be a little more important that you may have learned. But guys, when we look at muscle is really important in helping give you movement. It allows your body to also have some structure, but it helps more with the movement. They attach to those bones, and those bones create kind of like levers in that sense, and they allow for movement to occur. Your muscles, as they work, also convert energy into ATP. They use that ATP to create movement. So it goes from potential chemical energy to actual kinetic energy. And anytime we transfer energy, heat is released. And so your muscles are really important in helping create some of that body heat that you have as well. So if we take a look here, we can see some of the bones. Remember, they are classified by long, short, flat, or irregular. So they're shown here, giving you some ideas. It should kind of jog your memory back from anatomy. We also have the muscles, and in this case, it's showing you a lot of the more superficial muscles, the ones that are going to be more prominent on the outside, not so deep. All right. But again, you have things like your trapezius, you have, which we a lot of times term as your traps, your deltoid, biceps, triceps, quadriceps, which are four muscles put together. And then you have your like hamstring, your gastrocnemius. So there's a lot of different muscles that are located there. And again, those movements that these muscles end up doing for us are going to be things like flexion, extension, abduction, adduction, lateral flexion. And so they help us do different types of body movements. All right, so now we're going to switch gears a little bit since we did a little brief overview. I didn't go really deep into that. If you really want to see a review over bones and muscles, you can go look at my ANP1 type of videos, because there's a bunch more there, because that's where that focus is. What we're going to focus in on here is we're going to look at the diseases and disorders of these systems. So some common signs and symptoms that we see when it comes to your bones, okay, or joint disease, we see that pain is a big part of this, okay? Anytime there's movement or anytime those bones are bone on bone, there's going to be some pain. We also see swelling, Okay, so inflammation of the tissues, which causes swelling, decreased mobility, where the movement is hindered, and sometimes the joints even will become deformed. There's a deformity that's present. When we talk about muscle disorders, one of the main things is weakness, where the muscles are very weak and not able to do their job. Now, one thing to note about muscle disorders is that they may not actually be an issue with the muscle itself. Your muscles are controlled by, the movements are controlled by your nervous system. So it could actually be a neurological issue causing them to not communicate with the muscles, and then the muscles aren't being used properly. And so sometimes the underlying cause is not the muscle, it's actually the nervous system or the neurological system. So let's talk about some diagnostic tests that we might use for a lot of these different musculoskeletal diseases. So bones, a lot of times we're going to use x-rays. X-rays look at hard parts in your bones or your hard parts of your body. We may also see that CT scans may be used because these can actually give more details even with your bones. CT scans and MRIs can both actually show soft tissue as well. So if soft tissue is involved, like ligaments, tendons, cartilage, muscle, that can also give more indications of what's going on. We also have what we call the BMD, or the DEXA. This is a bone mass density test. Okay, so it's a dual energy x-ray, and this is going to look at your bone density. Okay, and this is really important when we talk about aging and osteoporosis. They can also do blood studies. Blood studies are going to specifically look at calcium and phosphorus levels because those both relate to bone health. We could also use ultrasounds. Okay, when they use a type of ultrasound, it's a lot of times to identify inflammation found in the joints and tendons themselves. And then they could also use an electromyography. An electromyography is known as an EMG, and this is to record the electrical actions or activity of the muscles themselves. So we can see if the muscle's actually trying to contract, or if it's in a sense kind of paralyzed. It's not being able to be utilized like it should. Okay, so that's an electromyograph. All right, so we're going to break these down and we're going to look at diseases of the bone first. All right, so diseases of the bone, they're going to vary from very mild diseases where you may not even notice that there's a potential issue to very severe. And these are going to be more common as adults age. And so a lot of these are going to be age related. A lot of times it's a wear and tear that happens on our joints and on our bones that cause a lot of this issue. And so the first ones we want to focus in on are spinal deformities. So our spinal column should align, and they actually check this. When you go in for physicals as a child, a lot of times they would have you like bend over, like pull your shirt up off the back and bend over to touch your toes, and they would feel your spine, making sure it was all aligned like it should be. There are times where that alignment is hindered or is altered. And so an example of this first one is kyphosis. Kyphosis is shown in A in this particular picture, and it's an exaggerated curvature of your thoracic spine. Okay, so we have cervical at the top, thoracic, lumbar, and then sacral, and it's the thoracic. It's that middle area that's part of your rib cage area. This also forms kind of like a humpback to take place. A lot of times this is caused by kind of bad posture, and it can potentially be fixed to a point with correcting some of that posture. Other times it could be due to a congenital defect. Bone diseases and even certain growth disorders could be associated with kyphosis. A lot of times kyphosis is known as humpback, and it is found a lot of times in menopausal women as their bones are starting to compress in their spine due to that osteoporosis that can occur after menopause. We then see lordosis. Lordosis is where we have an exaggerated anterior inward curve of the lumbar spine. So the lumbar spine is curved in too far. This is very common during pregnancy. You'll notice that pregnant women will walk and kind of waddle, and they push that, the belly's being pushed out, which exaggerates that low back. This is because they're very front heavy because of the baby, especially in the third trimester. So they're trying to compensate for that. Once the baby is born, normally the lordosis goes away because your posture returns back to normal. But this is also sometimes termed a sway back, and some people, even just genetically, have a larger curve here. Obesity can also contribute to this. So the more weight that's carried in the stomach area could ultimately lead to lordosis. The last one is one where the curvature doesn't follow its normal curves. It's not exaggerated. It's going to be where the curve is off to the side. This is a lateral curvature of the spine, and this is shown in picture C. In this particular case, this one is going to have a lot of back pain involved with symptoms. Ribs and shoulders are going to be affected, including like potential issues where there's compression on the lungs and even the heart due to that rib cage area. They could also have what we call blade hump, uneven shoulders, and even hips where one shoulder is higher than the other, as well as the hips. And this is going to be normally treated with bracing. Now, when we look at scoliosis, it is actually more common in females than in males, and it's very young females that normally this is diagnosed. Now, this doesn't mean males cannot have scoliosis. It just means it's more common in females. One of the main treatments with this is bracing. A lot of times at first, the brace will have to be worn 23 hours out of the day. The 1 hour it's not is when the child is showering or bathing. The rest of the time they wear the brace. As it starts to correct the potential curvature that's taking place, then they may end up having it where the brace is only worn at night or less amount of time. But it is really important that they continue to wear that brace as doctors prescribe. If bracing does not help with that issue, then you end up going to have to put rods in and things like that to help keep the curvature from being too extreme. A lot of times when we talk about any of these, there is going to be back pain and fatigue that takes place because the muscles are tired. And so trying to work on your posture, trying to get them to pull the proper way, eventually they go back to that normal posture that you're used to, and because of fatigue that takes place. These are all diagnosed by a physical examination. They can also do an x-ray to look at, especially when we talk about scoliosis, the actual curvature of the spine. And again, the big thing, it depends on the cause with treatment, but bracing is a big deal, or spinal surgery, especially for scoliosis. All right, so the next one we want to look at is osteoporosis. When we look at osteoporosis, this is going to be a metabolic bone disease. This is caused when there is a lot of times an issue or change in hormone levels. But what technically happens to the bone is that the spongy bone becomes more porous. Okay, spongy bone already has little holes in it. That's where it gets its name, spongy bone. But it starts to get to be where it's going to have a higher porosity. So the holes are going to be more abundant. They may be even larger, and this leads to decrease in the bone mass. So the bones start to become a lot weaker. Now, the etiology or the cause, there's many different causes for it, but one of the main causes is due to menopause. It's a decrease in estrogen levels, that particular hormone. And we do see this happen in women more than men. So men and women can both develop osteoporosis. We just see that women tend to develop it sooner due to their body, their estrogen levels tanking during menopause. So what are some symptoms of osteoporosis? This includes the fact that the symptoms, most of the time, guys, osteoporosis is often asymptomatic in the very early stages. They don't even realize it's actually happening and the bones are getting weaker. However, a lot of times it is diagnosed due to a fracture, that they fall, and where in the past the bones were strong enough to withstand that fall, in order to withstand that pressure that took place, that force. Now they don't, because the bones are weak. And so a break takes place, which then when they do an x-ray, they notice that the structures of the bones have been altered. They're more porous. And so fractures are normally the main thing that helps us in order to diagnose this, unless you're getting regular bone density tests. Bone pain and tenderness can also take place, and even height reduction. We can see that especially in women, because of osteoporosis, the compression of the vertebrae can take place, and a woman could actually lose up to 5 inches throughout that time of that compression that takes place. And it's kind of crazy because it doesn't happen overnight, it's over time, but it can decrease that many inches. So what's the treatment when we talk about osteoporosis? Well, there's really no cure for it. The big thing is trying to slow it, or to kind of pause it where it's at. We can't go backwards. It's just to try to catch it and be able to slow that progression. They can do this with medication, reducing certain risk factors, which we'll talk about in just a minute. Hormones could be a key, okay, where they can end up putting you on estrogen hormones or other hormones, and also mineral and vitamin treatments, because the bones do rely a lot on phosphorus and calcium, as well as vitamin D, and so these things could be helpful in helping with that treatment. So some risk factors of osteoporosis are listed here in this particular chart. You could have a family history. You cannot change your family history. So when it said reducing certain risk factors, some of these you do not have control over, including your family history. Also your age. You're going to have a higher risk as you age, and we cannot reverse that. But there are certain medications that cause or could advance that. And these are things like tetracycline, corticosteroids, aluminum antacids, some diuretics, and some anticonvulsants. And again, some of these things you cannot come off of. Like you really need those anticonvulsants if you have lots of seizures and things like that. But some of these you may not need to take on a regular basis. Again, being female, white, or Asian, you can't change those. That's genetically determined. And so those risk factors are always going to be present. But these are the ones you can change. One is lack of exercise. You can actually increase your exercise activity, which can help build stronger bones. Also, you can increase your calcium and through diet supplements, through diet or supplements. Another one is you can have increased risk if your ovaries have been taken out, because that's, again, the estrogen producing organ, especially in women. And so with that, you can't put the ovaries back if they needed to be taken out for a reason, but you could be on estrogen. That could help. Limiting your alcohol consumption. It doesn't mean you have to cut it out completely, but limiting that can help. Caffeine consumption can also help, making sure you limit that. Don't have huge amounts of caffeine all the time, because that high level of caffeine can actually affect the bones. And also smoking. If you can stop smoking, it will also help. So again, some of these risk factors are modifiable. You can adjust them. Others, you can't. Okay. So that's what we're looking at with some of those adjustments with treatment if you were diagnosed with osteoporosis. All right, so the next we want to look at is osteomyelitis. Osteomyelitis is inflammation of the bone, and it's caused by infections. Now, the most common infection is staphylococcal infection. So this is a staphylococcus bacteria that causes the infection, but it could be caused by any number of other infections, bacterial infections. But staphylococcal infections are the most common. So what are symptoms of osteomyelitis? Well, the patient tends to have high fever due to the infection and trying to fight the infection. They also have chills, tenderness over their bone, leukocytosis, and leukocytosis means increased white blood cell count because they're, again, fighting an infection. And they can even have bacteremia. And bacteremia means that when we do blood work, we actually find bacteria in the blood work itself. Now, this is an issue because sometimes this could lead to the patient becoming sepsis and even more sick, where we'd say they're going into like septic shock. Now, this does happen more common in adults with osteomyelitis after a trauma has taken place, especially a trauma where they've had to put hardware in. Let's just say that you broke your shoulder in such a way that they had to put like pens in, or in your knee where they had to do like a partial knee replacement, or put a rod in, or something that they had to put hardware in. It increases your potential chances of developing osteomyelitis. Now, treatment, guys, is very aggressive intravenous antibiotic therapy. So we have to be very, again, aggressive with it in order to try to get a hold of this infection, and it needs to go through the IV instead of oral antibiotics. If it is due to a potential trauma or an adding of hardware, we can do surgical debridement to try to help clean out that area as well. Now, prevention, proper care and treatment of wounds is a big thing with this. Anytime we break the skin, we increase the risk of potential bacteria getting in there. And so taking proper care of those wounds could help prevent potentially osteomyelitis. So our next one on here is osteomalacia. This is a softening of the bones. We do see that this could be due to a defective mineralization that takes place in the bones. In children's, we call this rickets. Okay, but this can also happen in adults. The etiology here is a deficiency specifically in vitamin D. Vitamin D is required for your body to absorb calcium. So you could be taking in calcium and having it take in just fine, but if you don't have the vitamin D that helps you absorb the calcium, it's going to leave through your digestive and urinary systems. And so it's really important that that vitamin D is up. And vitamin D deficiency is becoming more and more common. And this has to do with the fact that we don't go outside and we're not in the sun as often. And when we are in the sun, a lot of times our lotions, our makeup, our clothes have UV protection to help protect us from sunlight and potential cancer, but this also prevents your body, your skin, from making vitamin D. Now, symptoms when we talk about osteo, so symptoms here are going to be things like bone pain, loss of height, okay, because the bones have softened and they start to bend, and a bit bending and deformity of the bone itself. Now, the main treatment here is to try to correct the deficiency. If we can correct it or avoid the deficiency altogether, a vitamin D deficiency or calcium, especially when the child is growing, that's going to be super beneficial. Okay, it's going to help potentially keep rickets away and help prevent this particular issue. All right, so now we're going to talk about diseases of the joints. Now, when we talk about diseases of the joints, they mostly occur as a slow process. So they don't happen just overnight. It's not like a quick thing that takes place. It's going to be something that's developing over time, and it tends to get worse and worse. It's kind of more of like what we would consider like a degenerative disease. It's going to get worse and worse the longer that you end up having it. And so we do see that because of this, it's also more common with age. As we age and we get older, there's higher chances of developing these particular disorders. So the first group of disorders are going to be termed in the groups of arthritis. Now guys, arthritis is going to be, if you break down the word, arthro means joint, itis means inflammation. So this is going to be some type of inflammation of the joint. Now there are different subcategories of arthritis, and a lot of times it's dependent on what's causing it. So the first one is osteoarthritis. Osteoarthritis is a degenerative process. It's a wear and tear that's occurring out on the joints. So the joints are kind of wearing out in a sense. Some of the key things or risk factors that cause a development of osteoarthritis are going to be things like obesity. If you overuse these, even with you when you're young, if you're overusing those joints when you get older, you're going to end up paying for that. Injury, anytime if you've had any kind of joint injury, congenital musculoskeletal conditions can also contribute to this. Now, osteoarthritis commonly affects your knees, hips, hands, and spine. And we do see that pretty much everybody by the time that they're 80 years old does have some form of osteoarthritis. Some people have it earlier in life, but at least by 80, almost 100% of people would deal with this type of arthritis. This is also the most common type of arthritis. So what are the symptoms? Well, you'll have joint pain, so pain in that particular joint, tenderness and stiffness. The joint may become enlarged. The joint may also start to harden up and have kind of like these little growths kind of present there that harden up the joint. This could limit the range of motion, and you can also have crepitus. Now, crepitus is kind of like where you hear like this popping or grinding when you move the joint. It doesn't always have pain involved when you have crepitus, but that is a big part of it. So what are the treatments when we talk about osteoarthritis? Well, rest is one of the main things. Doing non-weight bearing exercises, and so especially exercises in water, like if you do aqua aerobics or where you do aqua walking or something like that, where you're walking in water, it actually does help because it takes a lot of the weight off the joints, but you're still exercising them. Heat can help. Analgesics, since that's pain medication, and anti-inflammatory medication can also help with osteoarthritis. Now, rheumatoid arthritis is also listed on here. This is the most severe or the more severe type of arthritis because it's more debilitating. It is an autoimmune disorder that affects the joints and connective tissue of the entire body. So it's not just the joints, but all connective tissue. But the joints tend to get hit pretty hard with this. And this was talked about a little more back in the immune system video. Now, I do want to do a quick kind of overview here of rheumatoid arthritis versus osteoarthritis. Osteoarthritis affects working joints, and rheumatoid arthritis can affect all joints. And so there's a difference, and you can actually see kind of the difference in the picture of the hand here. The first one is going to be osteoarthritis, and so you can see that certain joints are kind of larger. You can even see like in the middle finger, there's a little bit of a deformity that's taking place. That would be more osteoarthritis. But if you look at rheumatoid arthritis, there is a special structure that develops in those joints called pannus. And that's what you can see happening here. And it actually deforms the hand and makes it less functional. This is why it's a more severe type. Also, if you look at the picture at the bottom, you can see what a normal joint capsule looks like. These are synovial joints. You can then see in the middle with B what osteoarthritis can end up doing to the joint. You can still have growths in there, but they're more bony growths. You can have little pieces of debris in the cavity, that sort of thing. But if you look at rheumatoid arthritis, you can actually see that some of the tissue makes like a scar tissue connecting the joint, which locks it up to where it can't be used anymore. And so there is a difference between osteo and rheumatoid arthritis. The next arthritis we want to talk about is known as gout. This is a metabolic error in the breakdown of certain proteins that are found in foods. And so this is going to be a breakdown of protein, can end up creating these uric acid type of structures. And normally, guys, through digestion and that sort of thing, these waste products due to this breakdown are going to leave through your kidneys. Your kidneys are going to take care of it, and it's going to leave and filter it out of the blood. But during an issue with gout is this individual does not process these correctly, and those little shards of uric acid crystals get deposited into the joint capsules. And they do look like little shards of glass, and they cause some major issues. And so when we look at this, the primary symptoms that occur with gout are going to be primary joint that is affected is going to. So when we look at gout, the primary joint that tends to normally be affected is going to be the metatarsal phalangeal joint of the big toe. So the big toe is normally the culprit. And this has a lot to do with gravity because these uric acid crystals are going to be collecting in the joint cavities and they're not being filtered like they're supposed to. The blood that goes down into your big toe, if they carry it down there, it's going to be harder to get it out of there. And so this is where it normally can deposit. So what kind of symptoms happen in these joints? Well, you can see them in the picture here. They start to have redness, heat, and swelling, as well as pain. And this is due to the inflammation. Those are the cardinal signs of inflammation. But we also do see that a formation of something called a tophy can occur. And this is going to be where it's a very large projection on the joint. Now, the main treatment for gout is anti-gout medication, but also dietary adjustments. If protein is the issue, you need to limit the type of protein. Red meat tends to be one of the biggest culprits with this, and so a lot of individuals who deal with gout will want to kind of stay away from eating mostly red meat. They'll want to eat more meat like chicken or pork, that kind of thing. Now, we do see that this is going to affect men a lot of times more than women. Okay, and it can become very chronic if we don't take care of it with the medication and dietary adjustments. So some of the prevention that can take place is avoiding food high in purine, such as meat, poultry, fish, and other seafood, and also staying really hydrated. The more fluid you have flowing through there and your kidneys are having to actually filter and get that extra fluid off, that's more likely to actually filter out that uric acid as well. All right, so the next one is called the hallux valgus. In this particular case, this is a deformity affecting the metatarsal phalangeal joint of the big toe, but this is also known as a bunion. What happens is the big toe starts to move inward and it starts to crowd or even go behind the other toes. And the etiology behind this is really controversial. There's a lot of potential genetic evidence related to this, but it could also be related to certain footwear that you utilize. Especially women who wear high heels, that puts a lot of pressure on that particular joint, tend to deal with bunions more often. Now, symptoms include redness, pain, and swelling. And one of the main kinds of treatment that we look at this is changing the type of footwear that's present or that's being worn. And this is to offer more support and more room on the toe. We also see medications could maybe be helpful, especially more with the pain. But surgery is going to be what actually fixes this particular issue. Another problem with a joint would be the temporomandibular joint syndrome, also known as TMJ. If you've ever heard somebody who says, oh yeah, I've got TMJ. Guys, the temporomandibular joint is right here. It's your joint of your jaw. When you have this type of issue, you can get severe headaches and pain in the jaw itself. The etiology or the cause could be joint tissue lesions where you have lesions in the area. If you have an overbite, this increases this. Malocclusions. And malocclusions are where your teeth are not aligned properly, and improperly fitted dentures or dental work. If the dental work is not fitted properly into the mouth, it could ultimately affect the bone of the jaw. And so when we talk about TMJ, some of the main symptoms is going to be you have a decreased ability to open your mouth. There might be a clicking that takes place as you open and close the mouth, and there'll be lots of pain. So the main treatment here is going to be correction of the factors that cause it. And so if it's due to like an overbite, we want to fix the overbite. If it's due to dentures that don't fit, we want to make sure you get dentures that fit properly. That would help obviously correct the potential issue. But surgical intervention could be something that has to be done if it's too severe, if it gets to the point that those corrections can't be done without that surgical intervention. All right, so let's talk about diseases of the muscle and connective tissue, okay, when we're talking about the muscular part. So one of the main ones that we see here is called muscular dystrophy, also known as MD. This is an inherited disorder. It is genetic. There is a genetic component, and there are multiple types of muscular dystrophy, but it does affect the skeletal muscles. This is more common in younger individuals than the other ones that we've discussed because of the genetic basis. Now, symptoms, if you have muscular dystrophy, there's a wasting away of the muscles, particularly in the shoulder and pelvic girdles. And so this creates a lot of problems. As those muscles start to waste away, they get replaced with fat tissue. So the muscle still looks like it's pretty large in size. It has its normal kind of shape and feel, but it's fat tissue, not muscle tissue. So the fat tissue does not function like muscle tissue, and contractions don't take place. Now, with muscular dystrophy, guys, the survival rate in the sense of like life expectancy is, if they make it to the age of 20, that's very rare. And the reason being is there's this particular muscle that helps you with breathing. And if that muscle starts to be affected by muscular dystrophy, it causes the individual, the patient, to have to be on respirators. And anytime we put a patient on respirators, that increases their chances of infection and other complications, which ultimately could limit their life. And so this is what happens most of the time with muscular dystrophy. If the diaphragm and the muscles of the rib cage start to be affected by muscular dystrophy. Another one we see with the connective tissue with muscles is called a ganglion cyst. Ganglion cysts are a fluid-filled benign tumor that is going to be found in the tendon sheath, and normally it's near the wrist area. You start to see it more in the wrist area, like you can see here in this particular picture. Now, the cause for these ganglion cysts is unknown, but they do think that repetitive injuries to the area could be the ultimate cause. Normally, these are not painful, but they may rupture, and then we need to drain the fluid off of them. And so that's kind of the big thing here, is if they rupture, they could potentially be painful, and you can end up draining them to help with this. But they could come back, especially if repetitive injury occurs in that area again. Another one with the muscular system is tetanus. Tetanus is also known as lockjaw, even though it does not just affect the muscles by the jaw, but it is an acute infectious life-threatening disease. This is actually due to a bacteria called Clostridium tetani, and this particular bacteria releases a toxin. It's called an exotoxin that it releases, and the toxin is what actually causes the problem. Not really the bacteria, although the bacteria makes it, but the toxin is what actually causes your muscles to contract, rigid, strong contractions. And so this can be where those muscles are contracting so severely that it could ultimately break your bones. And so a patient that has this type of infection will have high fever. They will have tachycardia, where their heart is racing. They'll have dysphagia and intense pain. And so when we look at this, guys, a big part of this, it could take several weeks for this to develop with the toxins building up. But Clostridium tetani likes to actually be on like rusted metal and things like that. And this is why if you step on a rusty nail or you get cut by metal, they want you to get a tetanus shot, because it's going to be better, even though that tetanus shot hurts like crazy. It would be better to have the shot than to actually have tetanus. Now, the main treatment for somebody who has tetanus is prompt and immediate cleansing of the wound, and then, of course, the tetanus immunization, and this is known as the DPT immunization. This particular immunization, though, contains diphtheria, pertussis, and tetanus, and you should get a booster of this about every 10 years, but if you're not sure when you had it last, they may go ahead and give you the shot. It's not that big a deal if you get it more often. Now, if you already have tetanus, there is some symptomatic treatments, and these would be things like antibiotics and muscle relaxants to try to help with those contractions that are taking place. All right, so this is going to finish up part 1 that we're talking about with the musculoskeletal system diseases and disorders. We're going to come back in the next lecture and still continue on these, but talk about neoplasm, so like cancers of these systems, as well as looking more at trauma and some of the rare diseases. If you have any questions or concerns, please let me know.